Nearly 13,000 women are diagnosed with cervical cancer every year, but the good news is you can decrease your risk if the right steps are taken in advance. January is Cervical Cancer Awareness Month, and doctors are using it to draw attention to what you can do to protect yourself. So joining us to talk about a few of those things this morning is Dr. Yvette Williams-Brown. She's an OB/GYN at Seton. Thanks for joining us, Dr. Brown. What do people need to know, women, about cervical cancer?
Cervical cancer is a highly preventable disease. It is important for women to know that it can be detected through screening tests, such as the HPV test, and through Pap test, and it can be prevented through vaccination with the HPV vaccine.
Are there factors that may increase that risk for some people?
Yes. So even though the human papilloma virus, or the HPV virus, is very common in the population, about 79 million people have it, and about 80% of the population has been exposed or has had exposure to the virus. Other factors can increase the risk of developing cancer, such as smoking or having an immunocompromised status.
So how often should women get screened?
So women should begin screening for cervical cancer at the age of 21. And from 21 to 29, that would be every 3 years with a Pap test. Following age 30, or from 30 to 65, you have three options. One is to continue with the same screening as before, or to extend that screening by 5 years using just an HPV test alone, or combining that with a traditional Pap test.
It's something that I'm sure your doctor will be able to guide you, which direction you should take.
Yes, every person can go to their physician or healthcare provider to determine which test or the screening program that's right for them.
Cervical cancer preventable if you're being tested, taking the right steps?
Cervical cancer definitely can be detected early and prevented through vaccine. And when it is caught early, the chances of cure and treatment are much better than when we catch things later.
That was my next question, how curable it is once someone's diagnosed.
It certainly is something that we can cure, which is one of the main reasons why we want to detect this disease early, because when we catch these things early, then we have a much better chance of women living their lives as they normally would.
Well, thank you so much, Dr. Williams-Brown. I appreciate it. And again, this is Cervical Cancer Awareness Month, so you just want to remind people to get out there, schedule your appointment, make sure that you're tested.
Yes.
Thank you so much. Appreciate it. Well, here at KXAN, we are committed to helping you learn about your health, along with our partner, the American Heart Association. We have all kinds of resources and easy tips for living healthier on our website. Just head to KXAN.com and click on Simple Health.